Hi, I'm Mandy. I'm going to go over our aftercare kit that you would get after your osseous surgery at Dr. Dyer's office. We send you home with a soft toothbrush to use, a toothpaste, and a mouth rinse. These products you will use for the next 2 weeks to help you heal. We also send you home with ice cream to eat, which is nice, and it also serves like an ice pack, so that's why we give you that. You'll have 2 prescriptions, usually a pain medication and an antibiotic to fill, and there will be instructions on how to take those prescriptions. You may or may not have sutures. If you do have sutures, they're all dissolvable and they'll be gone within 3 to 5 days. We would like for you to refrain from using electric toothbrush, water pick, or flossing for the next couple weeks, and we will be seeing you back in our office at least 2 times to check your healing. We also would like for you to not smoke during this healing time, and of course we would like you to make sure you don't eat anything that's hard and crunchy like chips, seeds, nuts, peanuts, especially popcorn. And we will be going over all that with you as you're leaving that day.